Do you need another lung cancer biopsy? Determining if you need another lung cancer biopsy can be a complex decision. It often depends on several factors, including the results of your initial biopsy, the clarity of your diagnosis, the stage of your cancer, and whether more information is needed to guide your treatment. A lung biopsy is a procedure that allows doctors to obtain a tissue sample from your lungs. This sample helps confirm the presence of cancer, identify its type, and sometimes assess how far the cancer has spread. There are different methods for performing a biopsy, such as needle biopsy, bronchoscopy with biopsy, mediastinoscopy, or surgical biopsy. The choice of method usually depends on the location of the lesion and how accessible it is. You might need another biopsy if your first one was inconclusive. Sometimes, the tissue sample may be too small or might not contain cancer cells, even if cancer is present. If there is a need to reassess the tumor's molecular profile or biomarkers, especially if your treatment plan changes or if the cancer comes back, another biopsy could be necessary. If your cancer appears to have progressed or changed, a new biopsy can help confirm the current characteristics of the tumor or rule out a second primary cancer. Additionally, if the initial biopsy results do not match what clinical or imaging findings suggest, further tissue sampling may be required. In some cases, the lesion may be difficult to access with one method, and a different biopsy technique might be needed for better accuracy or safety. Lung biopsies should ideally be decided by a multidisciplinary team, including pulmonologists, radiologists, and oncologists. This team will weigh the benefits of obtaining more diagnostic information against the risks, such as pneumothorax, which is a lung collapse, bleeding, or infection. Needle biopsies guided by computed tomography imaging are commonly used and are generally considered safe and effective for lesions suspected of being cancerous. However, their accuracy can be lower for very small lesions. Newer methods, like bronchoscopy with robotic assistance, can improve access to small or deep lung nodules, providing real-time visualization during the procedure. Ultimately, the decision to perform another lung cancer biopsy should be personalized. It is essential to consider the clinical context, prior biopsy results, and how the results might impact your treatment decisions. Always consult with your healthcare team, who can evaluate your specific situation and recommend whether an additional biopsy is necessary to optimize your lung cancer diagnosis and management.